Hi, thanks for clicking the link to find out more about the health co-op. First off, there's several main benefits that jump out to most Christians who are interested in the eChristian Health Co-op. Better coverage for less cost is of course one. But number two, there's a lot of people that are really upset about the entire Obamacare setup, and this is a legal way to completely exempt yourself from Obamacare. This co-op has done such a good job over the last 19 years they've been in business that it's been recognized by the Affordable Care Act. In fact, it's the only nationally recognized plan of this sort that's been written into the Affordable Health Care Act code so that anybody who's a co-op member is completely exempt from the fines and the regulations of Obamacare. And thirdly, many Christians want a biblically based system. They're frustrated that their health care doesn't align with their values, meaning they don't want to help fund abortions or other procedures that their beliefs don't align with. They also believe in the old biblical ways of Christians helping other Christians, that they shared what they had for the good of the many and no one went without, to quote the Bible. This is precisely what the co-op does. I want to be clear, this is not health insurance, number one. Again, this is not health insurance. They are not a health insurance company like Blue Shield or Blue Cross. It's a non-profit cooperation group. And so what happens is they basically link up Christians from all across the country, and the money goes directly from one person to another person. And so they also ask you to pray for that person when you send the money. So there's very little of it that goes to administrative costs. So basically all of the money goes to member needs. And also, in 19 years of them doing this, there's never been a need that has not been met or paid. So if we look again at the last webinar that you watched, I'm using the same health plan here. You can compare, which is $877 for the plan that the enrolled agents and the Obamacare administration is wanting everybody to go into, which is these silver plans. Okay, so we already talked about this. I'm just going to highlight again here. The max out of pocket for an individual is $6,350, over $12,000 for a family. Now, if you compare that to the eChristian healthcare approach, the co-op, you'll notice down here that for each incident, there would be $300. That would be what you paid as the maximum. The maximum exposure you would have would be $300. And once you reached 3 of those for the year, you would be done. You would not pay anything more. So this would really eliminate your exposure, as you can see, versus the max out of pocket there. Okay? Now, the other thing to mention is, again, it's not insurance. So the typical deductible, max out of pocket, those kind of things aren't, you can't match them up word for word, so to speak. But the bottom line is, if you look at this, most people will agree that you've got a lot more benefit and the cost is actually less as well. I'll go into that in a second. But just to give you an example, let's say that you got sick and had to go to the doctor, and the cost was $265. Well, you would pay that entire bill, okay, as you noticed here, because it was less than $300. Now, let's say that happened, you had 3 incidents where that happened, and then the 4th one, you would actually be covered, okay? So that's how the co-op works. In other words, you would not pay the 4th one because you already had 3 incidents that happened that year. Now, let's say you have cancer or an accident or something like that. The max exposure you have is once again $300 versus on the typical health insurance plan, your exposure is $6,350. So you can see there really is no reason for the accident plan or the major medical plan if you've bought into the last webinar that I showed you, which I'm assuming you did, otherwise you wouldn't have clicked on this. And the other thing too, keep in mind, there's a ton more benefits with the health co-op that people don't realize. Is like, let's say again, if the bill was $265, well, if you call the co-op and you give them the opportunity to help you out, as long as you're in a major area, you're not in a town of 40 people or something, they've negotiated large rates for laboratory work and doctor appointments and visits and wellness visits and those kind of things, so that they're on a major discount. So the reality is it probably wouldn't even cost you the normal $265 or whatever you paid before you were on co-op. MRIs, all those kind of things, they've negotiated because they're so large, they've negotiated rates that are very affordable. So it's a much better ordeal, and as you can see here, instead of spending $877, you're actually looking, and again, this includes the critical care protection that we talked about from the last one, as well as dental insurance. You would save even more than if you bought the major medical plan that we talked about on the last webinar. You'd be looking at $604 versus $877. And one of the reasons for this is that it's because it's a nonprofit. Another reason for it is because they argue that their healthcare costs are not quite as large because, typically speaking, not always, but if you're dealing with the majority, everybody's a Christian that's there and their beliefs all align, well, you shouldn't be having the drug overdose issues and those kind of things that you might have with your typical health insurance. So the lifestyles are different there. So anyway, you're going to save even more money a month. And so the point is what could you and your family do with that savings? And a lot of people decide to become a better giver, which is one of their goals. Also, going back to the last example that we gave on the last webinar, instead of spending all this money where you're negative $315,000 over the next several years, and if you don't get a rate increase, you could go with the co-op plan, which gives you much better benefits, and you also would be positive now, even more cash than I talked about in the previous webinar. And if you're a group or a church, you could put this cash into private plans for each individuals, or come up with some kind of a health savings account or plan. It wouldn't technically be a health savings account because that is a term for the health savings account, major medical plans. But there's similar things like that you can do that would be much more beneficial. So